Okay. Welcome to the third part of a series of discussions on the impact of COVID-19. The Memphis and Washington area Tougaloo alumni chapters are committed to meaningful engagement with alumni of Friends concerning the pandemic and its tremendous long-term impact on the country and our society. Today's discussion is focused on how COVID-19 has affected the US and global economy, from unemployment, housing, and homelessness to the closure of restaurants and other small businesses. Today, our panel consists of Tougaloo graduates who are experts in their fields. I will introduce the panelists now. Our first panelist is Dr. LaTonya B. Washington, board certified in internal medicine and pediatrics. She's currently the physician advisor at St. Francis Hospital, Memphis. She's a proud graduate of Tougaloo College and attended medical school at the University of Tennessee Health Science Center. She completed a combined internal medicine and pediatrics residency at University of Arkansas for medical sciences and obtained a master's of business administration at Auburn University. Terralon Knight, Dr. Terralon Knight, is a board certified family physician, speaker, and physician coach. She is CEO of Knight Coaching LLC, as well as a medical director at United Health Group. A native of Macon, Mississippi, she has a passion for the underserved, with much of her career spent serving communities in the District of Columbia, Maryland, and Virginia. Dr. Knight is a proud graduate of Tougaloo College and obtained her medical degree from the Warren Alpert Medical School of Brown University. She completed her family medicine residency at University of Texas at Houston. Mr. Gregory Johnson is a community organizer, community lawyer, and community practitioner of philanthropy. His work focuses on leveraging private and public capital to build pathways to economic stability and mobility for low-wage workers. He is a member and chaplain of the Washington area Tougaloo alumni chapter. Mr. Alfred Applewhite is the managing principal at Applewhite and Associates Financial Advisors. With nearly 20 years of experience, Mr. Applewhite has been providing clients in Tennessee and Mississippi with financial services. He is a proud graduate of Tougaloo College and attends Union University, where he obtained his Master's of Arts in Education. Lastly, Dr. Princess Cry Parker serves the greater Memphis area as an associate real estate broker specializing in residential properties. With an accredited buyer's representative designation, Princess leverages her expertise in education to assist individuals and families with the process of buying and selling personal and investment homes. Princess also, as I said, is a Tougaloo graduate. Next slide. Today's discussion will focus on current medical updates and the economic impact of COVID-19. Little housekeeping, all participants' lines are muted. Please submit your questions and comments via the chat feature, and questions will be answered at the end of the presentation. Our disclosures for this evening is there are no disclosures unless explicitly stated by each panelist. The information presented represents the views of the individual panelists and may not be representative of their employers or event sponsors. The content presented in this presentation is intended to provide general information regarding the novel coronavirus 2019 and not intended as a medical consultation, diagnosis, or treatment. If you feel that you require medical attention, please contact your physician or go to the nearest emergency department. The content presented in this presentation is not intended to constitute financial or legal advice. Please consult your banker, financial advisor, or attorney for further services. Now we will start our presentation, the medical updates presented by Dr. LaTonya Washington and Dr. Terralon Knight.
Hi, good afternoon, everyone. So we're back again to continue to discuss COVID-19. One of the things that we would like to do is continue to bring your awareness to this disease and what it is doing in the country as a whole, but then also in your particular area. So last time we were here, our slide deck was very similar, so we'll kind of grow upon those things. And so we'd like to start with the demographics. And looking at the numbers, so the total number of cases, this was last updated last evening. So the numbers are likely higher at this time, but these were updated last evening. So the total number of cases in the United States was 3,181,846. And the total number of deaths was 134,059. So these numbers are substantial. I will tell you that the last time we came together for one of these COVID-19 webinars, the number of cases was around 1 million, and the number of deaths was sitting around 60,000. So we've almost tripled the number of cases and doubled the number of deaths in about 1 month's time. So that's very concerning. So we like to break it down by states. We are the Memphis area and Washington, D.C. area Tougaloo alumni chapters. And so we'll focus on those areas in this talk. So we want to talk about Mississippi. So there actually have been reports in the media that have said that Mississippi is one of the fastest growing states of COVID-19 cases and deaths. So right now, as of July 9th at 6 p.m., there were 34,622 cases and 1,215 deaths. I will tell you, when I was going through this slide deck to do updates from our last talk, which was on May 5th, I believe, Mississippi only had about 7,000 cases and had only a couple hundred deaths. And so the way that these numbers have increased in Mississippi was more staggering than any other state that I looked at for this particular presentation. So that's something to be really concerned about. In looking at Tennessee, the numbers in Tennessee are increasing exponentially as well. When we look at the number of new cases per day, you know, there have been several days within the last several weeks where Tennessee has really topped over 60,000 new cases in a 1 day's time. And then when we look at the number of people who are underrepresented minorities, the number of cases in those particular people groups, those numbers are going up significantly as well.
Hello, everyone. Tag teaming with Dr. Washington. It's Dr. Knight here, and I'm so happy to be here. Thank you again for joining us. So focusing on the district, again, Dr. Washington explained that our focus is here, but this is just is on Mississippi, Tennessee, and the DMV area. Here, taking a look at the district has done a pretty good job of testing so far to date. A total of 120,000, more than 120,000 residents have been tested, and you can see the numbers here. I'm sorry that I'm getting a little tongue-tied, just a little bit nervous, guys. With 91,143. Now, I need to explain that a little bit. So it says that 91,143 of those are residents. A lot of people who actually work and may not actually be residents of the district. So that may be a little bit of the discrepancy there. And 10,000 of those have been positive. Now, when I say we've done pretty good, we need to do better because the population listed for the district is actually 700,000. Now, going over to Maryland, we don't actually have a slide for this, but just to give you a little bit,
Terralon, I think we lost your sound.
Can you guys hear me?
There you go.
I wonder why.
Yeah, we lost your sound for a moment.
Okay, sorry about that. So hopping back on, just to, we don't have a slide for it, but just to give you some perspective to compare to the district. In Maryland, over 780,000 people have been tested, with 556,000 of those have tested negative, which is great. And we've been able to flatten the curve pretty well, such that only 390 people are hospitalized today. At first, when I looked at that number, I was really surprised. I expected that to be in the thousands, but you heard it right. Under 400 people are currently hospitalized, and that means that 270 are in acute beds and only 120 to date are in ICU beds. So Maryland has actually successfully opened up because we quote unquote flattened the curve. We hope with the measures that have been put in place with mandatory masks in public places, with 50% capacities and in spas, restaurants, and other public spaces, we hope that we can keep it there. So just to give you some perspective, and we can move to the next slide. Which brings me to mask wearing. The reason why states like Maryland have been so successful with flattening the curve, and that is because we an enforcement with wearing masks has been put in place. And I'd really like to stress how important it is, and we've seen that here. So here are some ways to stay safe. We really want to, I can't say it enough, please wear your mask, please wear your mask, please wear your mask. Don't touch your face, wash your hands often. Hand sanitizer if you can't wash your hands, but washing your hands with soap and water is always best. But if you can't, hand sanitizer when you can, before and after, and wearing a mask. And I actually have my mask here, and I'd like to show you how to properly wear your mask, because some people do not do that properly. Notice my mask is over my nose. It's not here. It's not here. It's not here. It's not here. And it's not here. So I've seen plenty of people walking around here. Your nose is part of your respiratory tract, meaning the particles from your nose will get into the air. The particles from your mouth will get into your air. Will get into the air. You are risking the lives of other people if you are walking around asymptomatic. So the proper way to wear your mask is here. And you have a responsibility to, if you see people working in restaurants and fixing your food or in your space, working in your space, to ask them, hello, sir, hello, ma'am, can you please put your mask on? Because you're essentially asking them to help protect not just themselves, but you as well. So I just want to stress that. Next slide. Oh, and I forgot, yes, 6 to 10 feet away. That's very important. Symptoms: dry cough, shortness of breath, fevers, chills, muscle aches. People have reported headaches, sore throat, diarrhea, many things that you hear with other viral illnesses like the flu or other viruses. The unique thing we hear about this particular virus is the loss of taste or smell. Another thing that we've been hearing is that people tend to think that they first think it's that their allergies are acting up. And you may have heard this a lot from, I'm so glad that people like Mayor Keisha Lance Bottoms and other high profile celebrities are sharing their stories, because they have milder symptoms and they think that they are okay, but it turns out they are actually positive. So if you're one of those people who has allergies or just thinks that they have allergy symptoms, don't wait, go ahead and seek out testing. So next slide, please. Now, if you have more serious signs, then that's when it's time to go to the emergency room. So trouble breathing, chest pain, confusion, or just a change in any of your, if you feel foggy, or if you see one of your family members, there's something not quite right about their mental status, headache, trouble speaking, bluish lips, then that's an emergency. Please seek out emergency care. Next slide, please. And I'll turn it back over to Dr. Washington at this point. Thank you.
Okay, so now we will talk about a bit about testing. I know Dr. Knight commented on the number of tests that have been done in the various areas, particularly in DC. One of the things that I will say is that there's still a good amount of areas within the country that are not doing the best job with testing patients for coronavirus infection. It's important that you check out your local, your state health department website or your county health department to determine what testing sites are available. But when we look at the tests, the viral testing tells you if you have a current infection. There's varying amount of availability for these tests. I've had people call me and say, you know, I went to the emergency room because I was having these symptoms and they said they would not test me for coronavirus. Well, a lot of the hospitals are not testing patients that go to the hospital unless they actually need to be admitted to the hospital. So then you should consider some of the outpatient testing sites that are available. Again, those are located on your local state or county health department websites. They should give you the locations where testing is available. It should say whether that test will be available to you if you have symptoms or if you're asymptomatic, and it should give you the times as well. One of the things that has really been pretty prevalent in the community is that the quality of the testing is really not the best. And by that, I mean that the test is only about 70% sensitive. And so what that means in real life is that if I have 10 patients in front of me and they all have coronavirus symptoms, or say they all have coronavirus, I know for a fact that they have coronavirus. If I do the coronavirus test on those people, then only 7 of those patients will have a positive test, even though I know that all 10 have it. So 3 of those patients will have a negative test, even though they have coronavirus infection. And so that's been a little bit hard to translate to lay people. So when people have called me and said, hey, you know, I have these symptoms, should I get tested? Absolutely, you should get tested. But then even if your test comes back negative, but you have these symptoms, then you should assume that you have coronavirus infection. And so you should isolate at that point and consider yourself infectious to other people. We've heard a lot of talk about the antibody test about a month or so ago. That was pretty big. We haven't heard a lot about that now. Basically, what the antibody test is a blood test that they can do for you to tell if you've ever had the coronavirus infection, the COVID-19 infection. Well, we don't really know the significance of these tests. So if you have antibodies to COVID-19, what does that mean? So we know that if you develop antibodies to the virus, that it does give you some immunity, but we don't know for how long. If you think about it, coronaviruses have been in existence for a very long time. Coronaviruses can sometimes cause the common cold. Coronaviruses have caused SARS in the past when we heard about other pandemics. And then we have this new novel coronavirus, COVID-19, or the SARS-CoV-2 virus. So they've been around for a long time. Now, if it's the common cold type of coronavirus, we know that you can catch the common cold multiple times throughout the season. We just don't know for this COVID-19 infection what that means. So once you get this infection, are you able to catch it again? And really the preliminary studies are showing that there is a possibility that you can get this infection again. And then when we talk about treatment, you know, one of the main things is that there really is no proven cure for this infection. And so that's a concern. There's no vaccine that is available at this time. They have several clinical trials underway. I feel like in the media, we hear something every couple of weeks about, oh, you know, they're on a breakthrough for creating a vaccine. And I will say, honestly, there are a multitude of clinical trials going on to create multiple vaccines, multiple medications to treat various illnesses. Normally, we never hear about these things at all. So the media is getting wind of these studies and they're bringing them to light. Usually, we wouldn't even hear about these things until they got to the point where they were in the clinical trials where they have been able to prove that they have been effective in some way. We don't have that at this time. Remdesivir is the medication that the FDA gave an emergency use authorization for. Some people do have a positive effect from the remdesivir. It is, the medication is not widely available. I have seen in a lot of the physician groups that have been talking about COVID-19 as a lot of facilities have shortages of remdesivir. They are having to decide which patients are appropriate for remdesivir and which patients are not, and they're running out of doses. And so that's definitely a concern. More recently, they've been talking about the role of steroids in treatment of coronavirus, and they are seeing some positive results for that. Plasma antibody trials are when they take the blood plasma from someone who has recently had the coronavirus infection and has antibodies and give it to a patient who's actively infected with the coronavirus to help their body boost the immune response to be able to fight off the virus. And again, as I said before, the vaccine development, usually it takes 1 to 2 years to create a vaccine for a virus. And so that's, you know, where we are. We're really only about 7 months into this pandemic. So my anticipation is that we won't be able to see a vaccine probably until probably 2021 at the earliest.
So I'm going to pick back up here because I know that there have been concerns of late about the cost. So the one thing that Congress did, or at least specifically in the Senate, back in March when the U.S. finally got a clue and, you know, figured out, okay, we really do need to get a hold on this. Senator Tina Smith from Minnesota authored a bill called the Free COVID-19 Testing Act that basically said that there will be no cost sharing for patients, meaning we need to make this free. If we want everybody to get tested, we need to make this free, meaning patients shouldn't be charged a copay. It shouldn't apply to their it shouldn't affect their deductible. And it shouldn't affect their coinsurance. So, and then if they're on Medicaid, Medicaid should pay for it. And and if they do not have insurance, Health and Human Services should pay for it. So that was the gist of the bill. Notice that I said bill, so it's not law, but somehow it has been messaged that coronavirus testing is free. Now, what most insurance, and for the most part, that is free. So because we realize that we're in a global pandemic, we are a developing country, it just doesn't make sense. So almost all insurance carriers, and I've checked their websites, have a dedicated page that says, if you have a visit related to testing, we will cover it. So I advise you to definitely go to the page. If you don't have insurance, and regardless if you do, please, as Dr. Washington said earlier, there are definitely, it varies from region to region.
Terralon, I think we lost your sound again.
I don't know why Zoom doesn't like me today. I have no idea why Zoom doesn't like me today. But I will definitely, you do know that each jurisdiction has been different as to how they've handled the pandemic, but definitely every state does have a page dedicated to telling you where you can get tested. And almost all of them do have a hotline, whether it's a warm line that's only available. I did check Mississippi's, it's Monday through Friday mostly, and they do have limited on Saturdays, and even some have 24 hours, or they give you a number where they will call you back. So there is a free available testing sponsored by the state, by every state. But you can also go to your primary care provider. If you do receive a bill, then, and this is where we can go to the next slide, then here are some things that you can do. If you're concerned, number one, I would start with the free sites, that we mentioned. Number two, you can always appeal to your insurance agency. Like I said, you can call their customer service line, or you can actually go to their webpage, because each one has language that says they will cover COVID-19 testing. I did read where some hospital systems are even holding the bills because they don't know what to do. They're afraid of the backlash because they are not sure. What they don't want to do is bill patients and then have to deal with reconciling those bills afterwards. Secondly, another thing that's happening is insurance carriers are making mistakes. What may be happening is when you go to the hospital or when you go to the doctor, they may not be filling out the right codes for the testing, or maybe giving the insurer the incorrect information. So it may be an honest mistake, and the insurance company may not know that this was a COVID-related visit. So if you see something wrong, say something. So you have to use your voice and just say, hey, this was COVID testing. We need to work this out. This needs to be removed. And you can start that appeals process. So speak up. And I also want to stress, if you think that you have COVID, the best place, if you are asymptomatic or you have mild symptoms, the best place, if you have insurance, the best place to start is with your doctor. Do not go to the emergency room, because the emergency room is for emergencies. Now, unless you have those warning signs that we spoke of. Now, if you have an emergency, then please head to the emergency room. But the number one thing that I do want to stress is cost should not be a deterrent for testing. By all means, we value your life even more, more over everything. Please get tested. Number one, wear a mask. And number two, get tested? I'll answer that question in the test at the in the chat. So that's it, and I'll turn it back over to Dr. Williams.
Okay, so I left this danger proceed with caution up because, you know, there's so much going on right now when we talk about reopening. They're talking about school starting. They're talking about many things that are happening. And I think my overall viewpoint is there's still a lot that we do not know about this COVID-19 infection and how it can affect others. So I will say proceed with caution. You know, I will again reiterate that it's important that we continue to do social distancing, make sure that we are only doing essential things outside of our homes, make sure that we are wearing our mask. I really appreciate Dr. Knight giving us the demonstration with the mask, the appropriate use of masks. When we go out, I'm sure we've all seen people who are wearing their mask as chin straps, they're having their noses out, and that's not an effective use of masking. And make sure you wash your hands as well. So with that, we'll end the medical update portion. There was one additional thing that I wanted to talk about. You know, we've heard a lot of people say, oh, people are having these COVID-19 parties where they are intentionally exposing themselves to COVID because they feel that young people don't get severe illness. You know, right now, when you look at the numbers, the average age of death is really about 60 to 70 years old, but that is not to say that young people don't have severe disease. And we don't know what the long-term effects of COVID are. What I've seen, I know several people who have had COVID, and also in the physician groups, we have heard reports of people who are having extended symptoms when their active infection is over. So there's a lot of post-infectious sequelae. People say that they have extreme weakness. They can have headaches for several months. They can continue to have low-grade fever. One of the things that people have reported is increased heart rate and types of cardiac damage leading to heart failure. Some people have constant anxiety because of this. If you imagine that you're laying in the bed, but your heart is beating as if you're running on a treadmill, that is something that will make people extremely anxious. They have worsening of chronic diseases like asthma. There are people who initially had very mild asthma symptoms, didn't have to use their inhalers on a daily basis. And now post-COVID, they're having to use inhalers multiple times per day. Chronic fatigue, excuse me, neuromuscular dysfunction, chronic renal impairment. One of the things for patients, excuse me, who have severe coronavirus disease is that many of those patients may end up requiring hemodialysis. And there's also been reports of significant clotting abnormalities, whether there's blood clots in the legs, lung blood clots or pulmonary emboli, and those blood clots can also travel to the brain and cause a stroke. So these things are not, it's not that you go to this COVID party, you get coronavirus infection, and then you get over it and you go on your merry way. There are some people that get really sick, and there's not a real way that we can quantify as healthcare professionals who will get extremely sick and who will not. And so with that being said, I will end the medical updates piece. There's a site of resources. I'm happy to provide those to you if you would like. You can just drop a comment in the chat feature. I can send it to you in an email. Also, if you guys have questions that are medically related, please put those in the Q&A section. Dr. Knight and I will go about answering those, and then we will go ahead to our economic implications starting now.
Okay, we will start with presentation from Gregory Johnson.
Awesome. Thank you all so much for having me. Excited to join this esteemed panel of two Bluens and in general, just good people. I think I'll situate the conversation by starting with a general statement that poverty is the intended consequence of conscious policy, and that in America, education has provided the knowledge, politics, the franchise, economics to capital, access to quality health care, the mental and physical ability to be able to get out and to do, and only when mixed with a fifth value, which is around spiritual and cultural nurturing, are we able to have a society where everyone is able to have access to the fundamental tenet that we ascribe to, which is life, liberty, and the pursuit of happiness. And so I'm excited to have been invited in on this third panel after we've spent some time thinking about the spiritual and cultural implications, spent some time thinking about what access to healthcare and what health thinks about, also thinking about what this moment means for the economic vitality and livelihood of Tuvaluans, but of Black and Brown people in general across this country. And so in light of COVID-19, many of you may have seen the news reports across the country that a report released by Neighbor a month ago has demonstrated that already 41% of Black businesses across the country have shut their doors and probably won't be reopening them. Fed Reserve is estimating that likewise, Latina businesses, 50% of them will close and will not be opened. Some of how we got here in this present moment is because much of the capital that has been needed to furlough workers, much of the capital that has been needed for businesses to shut their doors and to not be able to open has been denied to Black and Brown people systemically. What do I mean by that? I mean that the initial round of support that came to Black and Brown small business owners in the CARES Act was what we got, the PPP, the Payroll Protection Program. Well, 90% of Black-owned businesses don't have employees. And in that first round of PPP that came out in the CARES Act, there was no inclusion for self-employed people. So already 90% of Black-owned businesses got no access to that initial tranche of PPP funding. Beyond that, there is a limited, noted, studied lack of social capital for Black and Brown small business owners. So many of the people who were able to access that 10% were people who had very good relationships with large banks, which is why the Black and Brown people that you see, largely who were able to access the funds, were in businesses who arguably, unproven, could have floated this and survived this themselves. So beyond that first round, where effectively 92% of Black businesses were not allowed systemically from being able to apply for PPP funding, there was a fix that came out in the Payroll Protection Program Act. In that act, there were some changes that were made. One of the changes that were made were to have some carve-outs or some set-asides for community development financial institutions, or CDFIs, which generally, not always, not exclusively, but generally have better relationships with small business owners from affinity communities across the country. Needless to say that the dollars that were set aside for CDFIs, who already have limited debt capital to make loans with to any of their customers, right? Also had to undergo the same scrutiny as that first round of loans. In the Payroll Protection Program Act, however, there was an inclusion for businesses that have people who are self-employed. Ultimately, where I'm going with this, because I'm looking at the clock and I'm already 4 minutes into my time, is to say to you that there are going to be very limited opportunities for you as a small business owner to access federal dollars to support your programming, right? So just understand, I want to talk really plainly with you, not in an effort to scare you or not in an effort to take away your hope, but in an effort to allow you to prepare yourself to be able to access capital from some private resources, because public dollars, you should apply, you should use your relationships, your social capital at the banking institutions that you know, with the people at banking institutions that you don't work with, right? You should work every resource. But ultimately, there is a high probability that very few of the dollars that are being purposed by Congress are actually going to touch the small businesses in our communities. I'll underscore that the loss of these businesses is not only a loss in equity and wealth for the small business owner, but a loss of local jobs for people who live in our communities, a loss of access to local goods and services when it's becoming ever and more increasingly important to have local access to goods and services so that we aren't spreading the COVID virus, particularly in places where there are not contact tracers and real measures in place so that we are able to understand how the virus is moving from place to place. So here's what I'll say very briefly. If you are successful in securing a PPP loan, I'll largely speak to people who are self-employed or an independent proprietor, because this is where most small businesses owned by people of color fall. And so the high level points that I'll give you as advice is to choose wisely between the 8-week programming and the 24-week programming. And the way to think about whether you should be choosing between 8 weeks of programming and 24 weeks of programming is really to look at your profit and loss statement, your balance sheet, and to look at your ratio of debt and equity capital, and to make a real decision about how fast, based on how much you spend money regularly, right, you expect to spend on those services. Understand that as a self-employed person, it's a really wonky rule that to understand how much PPP you qualify for, it's your 2019 net profit divided by 12, because there are 12 months in a year, and then you would multiply that by 2.5. That would equal the amount of PPP dollars that your small business would qualify for. You say, well, Greg, it's a PPP loan, I'm a sole proprietor, I don't have employees, how is that forgiven? In the PPP Act, there is a rule called the Owner's Compensation Replacement, and effectively, using that calculation, when you apply for forgiveness, if as long as you have spent 60% of your dollars compensating yourself, and the rest of that dollar, and the rest of those dollars on rent, on utilities, on mortgage increases, then you'll be fine to have that loan forgiven. The other big point for small business owners, if you qualify for a PPP loan, is if you spend down the cash quickly in the PPP Act, another correction from the CARES Act, you are allowed to seek forgiveness of that loan or to turn it into a grant before December 31st, 2020. So there's a date certain on every PPP loan that goes out that it has to be spent down by the end of this year, 2020, which is December 31st. But if you get a PPP loan and you spend through that loan in mid-October and by the 1st of November, you should immediately apply for forgiveness, because going into 2021, you don't want that debt on your books, right? And if you have to apply for a subsequent loan, or if you have to apply for subsequent capital from a financial provider, then you don't want that on your books. Beyond that, I told you, most people are not going to qualify for PPP dollars. So I want to very briefly talk about what some other 2 points that I want to make. Whether you qualify for a PPP loan or not, I want to suggest that you right now reach out to the people that you know and get the contextual, technical assistance, and business supportive services that you need. I cannot tell you how often I'm on the phone line with colleagues who work at CDFIs, community development financial institutions, who are doing an amazing job of trying to process capital and get it into the hands of Black business owners in their communities to sustain these businesses. And much of the stories that they tell me is that, Greg, these are good businesses, but we literally had to have them email us documents so that we could create the PDF. We literally had to have them email us or text us copies of their books so that we could create the Excel spreadsheet or whatever it needed to look like to make sure that they were able to apply for loans. So if you don't have good balance sheets, good profit and loss statements, if you don't have 990s and recent tax filings, you really have to reach out right now and get the contextual supportive services that you need to proverbially get your house in order. And there's some people who are speaking after me who can give you much better direction on how to do that. I'm just saying that it is imperative that you do to be able to take on any private or public capital. The other thing that I'll say is that remember that this is not your fault, right? Many of the reasons that Black and Latinx businesses don't have these resources or documents is not because they're not shrewd business people. It's not because they don't have good businesses. It's because moving from a 4-star to to a five-star enterprise has seldom resulted in a profit increase for our businesses. It has seldom resulted in increased access to capital from private sources, and it has seldom resulted in increases in capital from the Small Business Administration. Even before COVID-19, only 2.5 to 4% of capital that was coming from the SBA was going to Black and brown folk. And when you think about the disaggregation between Black and Latino, you can understand how marginalized those numbers are. The second big point, because I'm over my time at this point, that I really want to stress is that you probably aren't going to get a PPP loan, but there are plenty of other places that are trying to support and to provide capital. And I'm suggesting that you should really do the hard work of reaching out first to the Economic Development Authority in your city, or if you're not in an urban area, you may have a regional development authority, but pretty much 90% of them across the country immediately and subsequently continue to raise dollars to support funds that provide micro grants and some loans to Black business owners across the country. So if you're in Atlanta, you should definitely be reaching out to Invest Atlanta. If you are in DC, you should definitely be reaching out to the Office of Equity Originations in the Office of Economic Development, led by Tim White. If you are in Memphis, I'm not sure, but trust me, they have an economic development arm of the city who has probably developed a fund to support small business owners. Outside of those funds that have been developed by economic development authorities, you should also be looking at the community foundations that are in your city, or if you are in a smaller place, again, it may be a regional community foundation, but regional and community foundations across the country have also begun to build funds to support worker relief, to support small businesses. And then I'll say look to the national and legacy organizations in some instance to provide some guidance on where there are national dollars. So whether that's through Rich Ludenis's New Voices Fund, which is exclusively focused on providing capital to Black and brown women, whether that's through Magic Johnson's endeavor with his enterprise that's putting $100 million in private capital into the hands of Black and brown small business owners, whether that's 4S Bay Partners in Chicago that is exclusively putting $25 million on the street as PRIs to support small businesses. Please reach out to the National Urban League, go to Google, go to their website, look at the aggregation of resources. I was going to pull a slide together and realize that really most of the legacy organizations have done a really good job of pulling together where there are funds absent PPP or EIDL. I didn't talk a lot about EIDL, which is the Economic Injury Disaster Loan Recovery Program, which is through the SBA. But again, I'll say to you that before COVID, less than 4% of dollars were flowing out of SBA to Black and brown businesses. We shouldn't expect that the EIDL loans will have a different story or a different arc than the PPP loans. And so the best advice I can give, and I'm really over my time, so I'm gonna stop now. The best advice I can give is to get the contextual support that you need so that you can seek out private capital and do the research and seek out the resources that are necessary to connect with private capital, beginning initially with the private capital that is dedicated to the place where your small business is or where you live, and then branching out to those national funds and national organizations who are really doing the hard work of removing the barriers to access to capital for Black and brown people. Thank you.
Thank you so much, Gregory. That was very helpful. And I hope we have taken down some notes. I think some of the things were put in the chat section. I think LaTonya may have put some things out there, but thank you very much. If you can kind of give us a list, Greg, just text us something and we'll send it out to the individuals who are participating on the call so that they will have that information. Next, we will have Alfred Applewhite, financial advisor.
Thank you. I want to thank everybody for having me. I wanted to take a little bit of time to talk about steps for quicker financial relief for you guys. I think this is a perfect opportunity to take advantage of the time that we have. I know a lot of us are working from home. Some of us have been furloughed. Some of us have been taking little pay cuts here and there. So I want to encourage you guys to take the time to reinvent yourself, if you will. Learn a new skill, get more certifications. If you already have a job where you're certified, do something right now to better yourself, to make you more marketable. That would help out. Also, I want to talk about finances as it pertains to household finances for the individual. There's not anywhere to go, so spending money online, you need to take a step back, start cooking at home. I know I've been cooking at home a lot here instead of doing curbside and spending money. Just to speak for myself here, we've been hoarding money around here because there's a lot of uncertainties out there. So I want to talk about that, and I also want to talk about making sure your family's basic needs are met, assess financial needs over the coming several months, and prioritize necessary expenses. If possible, use your tax refund or economic impact payments for food, medicines, and other items for your family's well-being, such as Medicare, housing and utilities, caregiving for children and other family members, telephone and internet to help you stay in contact, and of course your transportation. If your basic daily needs are met, pay your bills and your debts. However, if you're having trouble with paying your bills, be sure to ask for help. You may be able to pay some by the due date and the rest when you have adequate resources. You may be able to renegotiate your payments with your mortgage companies. They're suspending payments. I know I got my gym membership suspended because I'm not going to the gym right now. So those are things that you might want to look into that can help you out along the way. I'm also going to discuss, for the sake of time, I'm trying to speed up here, talk about little highlights from the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. For those of you who didn't know, it was signed into law by President Trump on March 27th. And I'm just going to do some quick highlights here. Like I said, for the sake of time, because I know we want to be respectful of your time. Gregory already talked about the PPP program, so I'm not going to really talk about that. I want to talk about the relief to individuals. Of course, you've already received your $1,200 stimulus checks. It's supposed to be another round going around. Be mindful of how you're going to use that money for individual, whatever you're using it for. A lot of people are spending, going to the malls. We've been seeing folks around Memphis here doing it as well. I want to talk about the unemployment benefits. Federal pandemic unemployment compensation. You get an additional $600 per week for those receiving unemployment benefits on top of whatever your states are providing. So I know my daughter is unemployed right now, so she's receiving that extra $600, and that's helping her out because she has her own apartment. The pandemic emergency unemployment compensation is an additional 13 weeks for those who have otherwise exhausted employment benefits. And also the PUA, the Pandemic Unemployment Assistance, is a type of unemployment insurance with broader eligibility guidelines, including an individual who is out of work due to pandemic, including formerly self-employed, contract workers, and gig workers. So that's very helpful for those that don't know. This information is out there at your fingertips. Student loans, those of you that have student loans, it creates a $14 billion higher education emergency relief fund to provide cash and grants to college students for costs such as course materials, technology, food, housing, childcare. You also can have your payments suspended payments and accrual of interest for federal student loans through September 30th of 2020. You can also suspend garnishments and tax refund interception related to federal student loans through September 30th, 2020. Retirement plans and retirement accounts. You can suspend required minimum distributions from traditional individual retirement accounts, IRAs, employee-sponsored retirement plans for 2020 as well. It also waives the 10% tax penalty for early distributions from IRAs, 401k plans, 403b plans, 457b plans. It also allows a one-year delay in repayments of outstanding retirement plans loans that are due between March 27, 2020 and December 31st, 2020. Afterwards, the loan amortization schedule should be revised to reflect the delay in interest accrued during that period. Also, if you are working and receiving benefits, this is really good for us here at home. Before we couldn't do it, but now your HSA account can be used to purchase over-the-counter medicine. That is really good during this time. So it allows health savings accounts, health flexible spending accounts, health reimbursement accounts, and medical savings accounts to pay or reimburse over-the-counter medicines and menstrual care products without a prescription or note from a physician as of January 1st, 2020. Credit reporting. When an individual is affected by COVID-19, requests and receives flexibility with their payment obligations from a creditor, the creditor must report to credit bureaus that the individual is in compliance with their payment obligations. And foreclosure and eviction moratorium. Sections 4022 and 4023 deal with mortgages, protecting those with federally backed mortgages from foreclosure until at least August 31st of 2020, allowing the right to request mortgage forbearance for up to 180 days. And that's it. I just encourage you guys to do your research, reach out to financial advisors. There's a lot of information out there online that you can use to your advantage in these trying times. So thank you.
Thank you very much. I'm hoping that we are listening and getting the information and trying to write some things down, because there is some really important information that has been given to us today. But as I said with Gregory, we will definitely try to get the information so that we can get it out on the website or on our Facebook page so that you can have that information going forward. Now we will have Princess Parker.
All right, good evening, everyone. Good evening. It's great to join. So Alfred gave a great segue by talking about the relief that's being offered for mortgages. And of course, certainly check with your lender, because different lenders are doing different things as far as the repayment is going with that. But surprisingly, the mortgage industry is still pretty fast right now. So I want to offer some tips to home buyers and home sellers, because it is still a fast moving market. And there are some things that we're doing a little differently in the market to help home buyers and home sellers as well. Of course, a lot of this is being spurred by low mortgage rates, of course. And it's creating even more of a fast paced, even with the change in our social landscape with the effects of the pandemic. So of course, the way things are operating in the mortgage industry is a little different right now. The percentage of homes that sell at or above the list price has been at 90% in the last 4 years, and it's even going higher now. So it's a very competitive piece. You can imagine there were a lot of sellers who were homeowners who were ready to put their houses on the market. And when all of this hit, of course, no one wants anyone coming in and out of their homes. So we're doing things a little different in preparing for that. So just want to cover very briefly just some tips for home buyers, those who are in the market to buy, because we have seen a little of that slow down at the very beginning, but it's starting to pick up as things are starting to open up, and we'll see how that continues. So just a few tips for home buyers. Certainly understand that this is a very fast-paced market. With that meaning anything that's halfway clean and decent sells very quickly. And this is across the board in urban areas, especially in that price range between 150 and 400. So we see a lot of multiple, almost anything that's clean and decent is going to go in a multiple offer situation. And what I mean by that is there are multiple buyers vying for the same house. So it's still technically a seller's market where we have more buyers out here than sellers. So you can imagine that pushes that home price up to sell at or above the asking price. So buyers have to be very prepared to go in knowing what you want and being able to make that full price offer. And my suggestion, of course, would be to look at homes that are not at the very top of your price range, so that you are able to make full price offers and what have you. So this is for those of us who are on here, and also some information that you could share for those that may be in the market as well. Certainly expect the competition, because that's certainly going to be there with the multiple offers. Lending is a huge deal. Of course, it's always good to have a local lender, especially with the competition being so high, someone that you can go and put your eyes and hands on, and also that can get all of your underwriting done on the front end, so that sellers are more confident in your buying power. We are starting to see some changes with how lenders are qualifying buyers now. So where we, for example, used to have a minimum of a 640 for credit score when it came to securing an FHA loan, now it's 680. So that has driven it up because of loss of jobs, and lenders are doing even more of their homework on the front end before they issue those pre-approval letters. So those are some of the things that we're seeing there when it comes to getting buyers pre-qualified. There are other options that the pandemic has created when it comes to viewing homes. Of course, now we're in a virtual world, so a lot of homes are being viewed online. And when they're not there, of course, we're able to go in and help people to view homes so that there's not so much interaction in and out. Masks are required, so even when you do go and do personal visits, you have to wear a mask and ask not to touch surfaces. So a lot of those things are really affecting how things are being done, but it has not slowed business in the housing market much at all. So one of the other things that I would suggest is to, especially with the market being like it is, sell your house first. If you own a home and you're looking to purchase another home, it creates a stronger offer with situations like this when it comes to multiple offer, when you don't have an offer contingent upon the sale of a home. So that helps tremendously. So one of the other big things that this has changed is inspections. Of course, very few people buy a home without having it inspected, but of course that means spending an extended amount of time in someone else's home. Typically, those homes are not vacant. So one of the options that inspectors are giving those home buyers now is to FaceTime and Zoom while they do the inspection, especially at the end, so they can review things and they don't have to, have that extra exposure to homes in and out. So that's a huge part of that as well. Very briefly, I'll cover just a couple of recommendations for those homeowners when it comes to selling your homes. Because of the climate that the pandemic has created with it being such a fast-paced market, even more so now, sellers, you certainly don't have to entertain any lowball offers to be frank. So we see all offers are coming in, almost all, like I say, if it's halfway decent, coming in at and above asking price. So this is not a time to panic and create situations where you have to accept anything less than what your home is worth. You can expect now with this situation as it is to have more serious buyers because we know that it's taking a little more to qualify. So with everything going on, with us being extra careful and having to make the extra precautions of wearing masks and gloves and things of that nature, you don't have people just going to look at houses just to look right now. So that we've seen where the traffic has kind of stepped back a little bit for people who are not as serious. So the sellers don't have to worry about so much traffic going in and out of the homes. So that's a huge plus there. There is not really a reason now, unless it's a personal job situation, to wait to sell your home if that's something that you were looking to do. Because again, this is an opportune time because of mortgage rates are still low, and we're starting to see the traffic pick up now. So it's still a very solid market, surprisingly. Mr. Applewhite mentioned earlier about some of the things that you could do in situations where you are a homeowner and you have experienced some of the challenges that have come with job loss and things of that nature. Lenders are doing various things to accommodate home buyers. So I would suggest that you go and talk with your lender about what those options are, be it forbearance, and always check to see how that loan is going to be taken care of after that period is over with. That's a very important part of it as well. So if there are any questions at the end, I'll certainly entertain those questions. Thank you.
Thank you so much, Princess. Now we will, I don't know, I'm not sure if there are any questions in the chat box or if they've all been answered.
There were a couple of questions in the chat box, and they were medically related questions. We haven't had a lot of economic related questions, but I can review those. So we had one question for the physicians, and it was, is it safe to ride in a car with individuals who do not live in the same house with you, but they all wear a mask? And I replied to that question stating that the current recommendations are for you to limit your exposure to people who do not live in your home. But if you must ride in a vehicle with someone who is not living in your house, then everyone who's in the vehicle should be wearing a mask. And then the next question was, do you think Mississippi COVID crisis is in the first wave or the second wave? And my response to that question was that it's still the first wave. So if you think about a wave or a bell-shaped curve, you have the cases go up and then they must come down. Mississippi and really most other states never saw that peak and never saw the number of cases go down to an acceptable rate. So most areas are still very much in the first wave. With that being said, all areas must reach their peak and see the numbers decline before we would even consider a second wave. So those were two of the questions that we have. I'm also manning the Facebook Live as well. There were a couple of questions there. We do have one financial question. If I have to sell a house and give the house back to the lender, how does that affect the taxes that are filed? Is anyone on the panel able to answer that question?
That would be one you would want to consult with the attorney, whoever was closing out that home.
Okay. Another question from the Facebook Live feed. Is it safe to rent Airbnbs on mini vacations over hotels? Dr. Knight, do you want to take that question?
Thank you. I was just trying to check my Facebook. So I have seen where a lot of people have taken this choice, and I've been toying with that myself. So my my position on that is, if we think about the fact that coronavirus, the virus actually needs a host. And we know that the concern is mostly for droplets in the air. I think that typically, and again, you should really consult your doctor, but because I don't know what your health history is, but typically I think that it tends to be a safer option than most options out there. But with this particular caveat, I would also take my own cleaning supplies and clean from top to bottom, and take the necessary precautions. That means still take and I'm not advocating, I'm not a brand ambassador for Lysol, but take your cleaning products and clean from top to bottom, clean every surface that you intend to use. But I do think it's a safer option than most. So that's my general advice, that I think it's a safer option, with the caveat that you take your own cleaning products and that you clean thoroughly, especially those surfaces that are used often, including the remote, the phone, if there's a phone there, doorknobs, refrigerator handles. So you have to be thorough. So you have to decide if that's worth it.
And I would say that I agree with that. And that's for if you are staying, whether it's an Airbnb or a hotel situation, I would recommend thorough cleaning, taking your own cleaning supplies, because how items may need to be cleaned may not be done so by hotel staff, or may not have been done by your Airbnb host before you left that area. A couple of other questions that have come in. There was a question that relating to the PPP loan, is there a size limit on small business applying for the loan? And Greg answered that. He said it under 500 employees qualifies for the PPP program. Another question, do we know the economic impact to African Americans during this pandemic? And do we know that impact by state? Is there somebody that can answer that question?
I'll very briefly speak to it. We know that across every traditional measure of wealth, of measuring the wealth or the racial wealth gap, that Black people are more vigorously impacted. So for instance, the unemployment rate for Black people due to COVID-19 is 13 times the rate for white counterparts, right? And so you can get some data. So you can literally find the data for unemployment rates disaggregated by state and even by place. And so you can just Google that if you want to see the unemployment data. There are studies that are beginning to come out that demonstrate how Black businesses have received the less amount of care and also have been closing at a rate astronomically different than other people, right? And so NBER, has been doing really good studies and reporting on that. If you're interested in seeing a disaggregation of that data of how that 41% breaks down by place. I will say that there is not yet, to my knowledge, one place that you can go where the data around unemployment rates, the data around what's happening with Black and brown small businesses, the data around what's happening with the rent and mortgage crisis. But we do know across all of these measures that Black and brown people have been disproportionately impacted.
Thank you for that answer, Greg. And then one other question that we got into the chat feature. Many children who are COVID positive do not have fever or cough. Therefore, what are methods school staff can use to make sure there's no viral contact and spread? I can answer that. One of the things that people are talking about now is the return to school. We do know that there are a lot of people who are asymptomatic, and they certainly can still spread COVID-19. A few of the things, it looks like Terralon did put an answer into the chat feature. And she answered in the very way that I would, saying mask all the time, social distancing, frequent hand washing, and sanitizing surfaces frequently. And if there are any signs of unusual symptoms, send to the school nurse. Now, with one caveat that a lot of schools don't necessarily have on-site school nurses, a lot of those schools tend to share school nurses as well. And then one other question that we got in, is there a limit to how many free diagnostic tests an individual can have? That I'm not sure of. I think that if you are having multiple exposures, then you should be tested at a certain interval. I don't know that there is a limit. That would depend on your local, you have to check with your state or county health department to see if there's a limit. I do know that when patients are in the hospital with COVID, we do test them at frequent intervals, and there is no limitation on that. But in an outpatient setting, I'm not sure about what the limitations to that would be. And then I just wanted to share with you guys before we end about the polling questions. So there were 3 questions that were in the poll, and we did have a good number of people that go in and answer these questions. So have you been diagnosed with COVID was the first question. 100% of the people who answered the poll said no. The next question was, do you know anyone who has been diagnosed with COVID? And in that instance, 81% of the people answering the poll said that yes, they knew someone who had been diagnosed with COVID, and 19% of people said no. And then the third question is, do you know anyone who has died from COVID? And of the people who answered the poll, 63% of the people said that yes, they did know someone who had died from COVID infection, and 38% said no. So I think that's pretty, telling. You know, if you don't know someone who has had COVID, you will. If you don't know someone who has died from COVID, then you will. With the way that this infection is continuing to wreak havoc on our community. There was one additional question from someone in the Facebook, on the Facebook Live. This person said they are a breeder and they got approved for PPP. I want to use the money to purchase a shed to house my dogs. Can I provide receipts for this purchase to get the PPP loan forgiven? Greg, I'll let you answer that.
No. So the very quick answer on that is no. The PPP loan is literally a payroll protection loan. I will say that depending on the date your loan was certified, if it was certified after June 5th, then 60% of those dollars have to be spent on payroll. And if you are a sole employer, I talked about the rule that you have to satisfy earlier. The other allowable expenditures are related to rent, are related on things that you already owned, right? And so if you could not have taken possession, and I'm not looking at the statute right now, but it was at whatever date certain in February. So you can't buy or lease anything new. If you had something prior to February, you could write that off for forgiveness. But the quick answer to the question is no. The allowable expenditures outside of payroll are related to utilities, rent, increase in mortgage rates, things like that.
And then one question that I have, I know people who own small businesses, and one of the questions that they had about the PPP is, I know one of the stipulations is that you cannot let go of any employees during the time to be able to remain in compliance with the PPP funding. If someone during that time quits, then what are the implications of that for the business owner?
Right, so the not providing legal advice, I'll say that first, and then I'll say, so the reason the person, so if the person quits, right, and if it is clear that the person quit and not that they were fired, which is a different scenario. I want to be clear. If the person quit, as long as there was an immediate and reasonable search and replacement of the person, you can still qualify for forgiveness of the loan at the end of it, because the spirit of what the loan is trying to do is you do have to maintain the number of people you have employed, right? And so if someone quits, or if someone decides to leave, or if someone, so it's allowable that it's not the exact same people. What isn't allowable is to let people go, right? Saying that you couldn't pay them when you took in this loan, which was exclusively meant to pay people so that you wouldn't have to let them go during this tough time. But if someone quits, as long as there is a reasonable and immediate search to fill the position and fill it, right? You can't just look, you have to actually fill the position. You still qualify for forgiveness as a part of your processing. The other thing that I remind people is that the number has to be maintained, and also just remember the percentages. So if your loan was certified before June 5th, then you have to spend 75% of it on payroll, right? If your loan was approved after June 5th, which is when we got the amendments or the fix, you have to spend 60% of your PPP on payroll.
Thank you for that. And to remain mindful of everyone's time, if we have any other questions, we'll probably give maybe another 1 to 2 minutes, then we'll close.
I just throw one to Princess? I was gonna say, man, I just throw one to Princess. Princess, I live in Brooklyn Heights. I'm home in Mississippi, but I live in Brooklyn Heights in New York, which has experienced 40% of people like me moving out, right? In light of COVID-19, which has also actually decreased some property values and made it potentially a good time to buy in Brooklyn when it's never a good time to buy. Because, and so I'm just wondering, like, if there, for those of us who are interested in investment properties, how would you balance that? And maybe this is one that Mr. Applewhite should also jump in on, as economists are forecasting a depression in 1 to 2 years, right? But we also have a good time to buy things. I'm just wondering, like, what's the balance in that? Do we buy a house now in Brooklyn Heights? Or Mr. Applewhite, do we not? Because the depression is coming and we should be saving all our coins.
Well, that's entirely up to you. I wouldn't per se advise. It all depends on what your financial situation is. I own 2 rental properties, and I'm looking at a third right now, and we're kind of, trying to see, what the climate is like, because it's up in the air, really. So it's kind of hard to say. I would wait, and I'm thinking, just to wait maybe a month or 2, just to see what's happening, because I don't expect rates to change much at all. Right. I mean, they're gonna remain low.
They are, and one of the things we're seeing is an influx of investors from your area. As a matter of fact, from the New York area, we see a lot of California investing here. Because we realize that, just what's going on. 2, people still have to have somewhere to live. And right. So, we see this is a great time for investment properties. It's, especially now with interest rates being low as well. Yeah.
Okay. Well, thank you. I don't think we have any other questions. LaTonya, there are no questions.
I didn't see any additional questions.
So, to be mindful of time, as we've all said, I'd like to thank our panelists for providing such important information, which will allow us to continuously and cautiously deal with the impact of the pandemic. So please stay well, stay connected, and stay vigilant. I want to give Kathy Mosley, who's on the phone, president of the Washington area Tougaloo Alumni Chapter, as Greg is waving his hand, and Terralon, yes, These are Washington people, and thank you so much for participating with us today. I want to give Kathy a few minutes to give us some remarks, and then we'll close out.
Let me just double check. I'm not sure if people on the phone can make remarks based on how this was set up. Kathy, if you can you start speaking, and then we'll see if we're able to hear you. Let's see. I don't think we have the ability, let's see, to do that.
Okay. Well, Kathy and I have spoken, and she is definitely supportive.
Maybe not.
There she is. Okay.
Kathy, can you hear us?
Needs to unmute. Will you unmute
Yeah.
your phone, Kathy?
Can you hear me?
Yes.
Oh, okay, great. Well, of course, I certainly want to thank our expert panelists for their willingness to share such a wealth of information and to do so in a way that kind of leaves us motivated and energized somewhat to adhere to the prescribed protocols. Additionally, we are reminded to also be realistic, if not hopeful, about the business options. But of course, it is so comforting to know that we have such capable expert professionals on our team who can give us straight answers to sometimes difficult and awkward kinds of questions. So, of course, we thank everybody who's who registered and participated in the conversation and raised questions that perhaps we all benefited from. And lastly, I want to thank the Memphis chapter for giving us the privilege of partnering with you to collaborate on such critical issues. So thank you to all.
Thank you so much, Kathy. If there is nothing else, or if you have any other additional questions, feel free to reach out to us on our webpage, on LaTonya's Facebook page. And LaTonya, can you give us that address very quickly?
Yeah.
And then we will.
Yes. So for those of y'all who would like to follow on social media, it's at Dr. LaTonya Washington. That's how you find my professional page on Facebook. I am continuously updating with COVID facts and stats. If you have any questions, then please do that. And we've generated a lot of buzz surrounding these webinars, and we've had others request additional webinars. So we are considering right now getting one in the works on technology during the age of COVID, and also potentially one on COVID and the education system in the U.S. So those are upcoming things. We all understand that these are two hot topics that are going on now. And so we just thank you guys for joining us today. Our goal is to really get the word out and educate people. If you have any questions, please don't hesitate to reach out to us.
Okay, thank you to all of the participants who joined us today. And as I said, please stay well, stay connected, and stay vigilant. Thanks again.